I'm Casey. I'm the pharmacist on staff today. How may I help you?
Hi, I'm here to pick up a prescription.
Okay, may I have your name and date of birth?
It's Jane Dane, 10/10/53.
Okay, it looks like I got a new inhaler sent over from Dr. Jones this morning. Sound about right?
Yeah, he said he was going to send it over.
Okay, this one is a little bit different from your previous inhaler. Do you mind taking a few moments and I can talk about some specifics with you?
Yeah, I can do that.
Okay, you can go ahead and have a seat.
Okay.
Alright, so the name of this medication is Breo Ellipta, and it's composed of 100 micrograms of fluticasone furoate and then 25 micrograms of vilanterol.
Oh.
So if you see that on the inhaler, it's the same thing. And what did Dr. Jones tell you this medication is for?
He said it was supposed to help with my asthma, and then I think he said something about my COPD.
Yep, that's correct. So this inhaler is used to treat both asthma and COPD, different from your previous inhaler that just treated asthma.
Oh, okay.
And how did Dr. Jones tell you you're going to take this medication?
He didn't say.
Okay, so you are going to do one puff every day. Again, different from your last inhaler that you only use as you needed.
Oh, okay.
So you're going to take this once a day. Try and take it at the same time every day. If you happen to forget to take it that day, that's okay. Just take it as soon as you remember. You just don't want to double up on the dose for the day, so don't take two at once.
Okay.
So I can show you how you're going to use it. And when you take this inhaler out of the packaging, it is only good for 6 weeks. So
Okay.
just a little reminder about that. So how you're going to use it is if you pull this piece down here, it's going to click. Did you hear the click?
I did.
Okay. And then this counter is going to count down.
Okay.
Yep. So then what you're going to do is that you're going to exhale fully and just try and exhale away from the inhaler. And then make sure when you're ready to take it, don't put your fingers over this vent right here.
Okay.
So then you're just going to inhale, put your mouth around the mouthpiece, inhale deeply, try and hold your breath for about 10 seconds or as long as you can, and then you can exhale fully, and then you can close it up. And one thing that I want to note with this is that make sure you don't click it open until you're ready to use it, otherwise you will lose out on that dose.
Oh, okay.
And then once you've exhaled, you make sure to rinse your mouth out with water, and then don't swallow the water, just spit it out. This is going to decrease your chance of getting a fungal infection in your mouth.
Oh, okay.
And then on the counter here, once it gets down to 10, it will turn red, and then that serves as a reminder to go ahead and give us a call, and we will refill the medication for you, so then it's ready when you need it.
Okay.
All right. And then did he tell you anything to expect as far as side effects?
He didn't discuss that with me.
Okay. Most common, maybe just some nose and throat irritation, runny nose, headache, and then some rare side effects, but they are severe, so I want you to be aware. If you notice any dizziness or changes in vision, you want to contact your doctor about that. Also, any signs of an allergic reaction, so shortness of breath, itching, hives, things like that, contact your doctor.
Okay.
So since this medication is different from your previous inhaler, do you mind showing me how you're going to use it?
Sure.
Okay.
So you mentioned that this is a dose counter.
Yep.
So it'll go down every time I use a dose. I'm going to open it like this.
Yep.
And then when I use it, I have to exhale away. Then when I inhale, I need to make sure my fingers aren't over this vent here.
Correct. Yep.
Okay. Yeah, I think I understand
Yep.
that.
And then just make sure you rinse your mouth out with water.
Okay.
Yep. And then don't click it down until you're ready to use it, so you don't miss out on the dose. But I think you got the gist of it.
Okay.
So put that in there for you. All right. So do you smoke, or does anyone in your house smoke?
One of my friends does.
Okay. Have you maybe talked to them about quitting smoking before?
No.
No? Okay. Well, to get the best benefit out of this medication and to decrease your chance of, getting a flare-up and having to end up in the hospital, it is best that you completely eliminate smoke exposure. So if you want to have a conversation with them about that and they are considerate more, they can come in and we can help them through the process of quitting smoking.
Okay.
Another thing I want to mention, patients with COPD are at a greater risk of getting pneumonia infections. We have vaccines ready and available here, so if you just want to take a few more minutes since you're already here, I can go ahead and get you vaccinated, so that way you don't have another chance of ending up back in the hospital.
Sure, I'm already here. I might as well get
All
it
right.
done.
Okay, well great, I'll get that going for you. Do you have any other questions for me?
I don't.
Okay, well, if something pops up, feel free to give us a call. We'll be here.
Okay,
Thank you.